Hello, everyone. This is Dr. Koehler with OccDocOne. Thank you so much for joining us. And I am very pleased today to have Barb Chambers with Emergency Urgent Care out of North Carolina with me. And she is one of the early adopters of OccDocOne. Thank you very much, Barb. And what I'd like to do is just get some feedback from you about OccDocOne. What would you say offhand is what you like the most about the tool?
I would say that we had been looking for a while for something, and we didn't know what we were looking for that would be structured to help us with our providers. And we've actually expanded it more into our clinical staff, nursing and x-ray, and our medical assistants as well, that would give them the knowledge and a place to go for specific urgent care, occupational injuries. There's also videos in there regarding sutures. We just needed one place, and we needed one platform, especially for our new providers coming in. My medical director, one of the things that she had discussed was, when you're going through medical school or nurse practitioner or PA or whatever it is, urgent care is different. And it's not something you get training in. So that was a big barrier and a gap in our learning curve, honestly. And we wanted to find out, how can we make it more robust? How can we make it so everybody's seeing the same thing and have access to the same knowledge? When Dr. Koehler had presented and we were a beta tester for OccDocOne, we were very excited. It had already been developed, and with the years of experience and knowledge, and we were really thrilled and excited to be able to then implement that into our onboarding. And we have since, you've heard of the Great Resignation, that happened this summer. As we are ramping back up and hiring, it has been crucial to getting those providers up to speed, because employers are hiring again, and we have injuries coming back in the occupational medicine.
Great. Okay. So as the providers dig into OccDocOne, what are they saying to you about it?
Well, just yesterday I was talking to one of my newer providers, and he was so excited, and he's brand new out of NP school, and he said that he had several different apps that he had to go to when looking for differential diagnosis, and looking for this and looking for that and looking for this. He was so excited going through the trainings, and just that, you can go into the library and you can pull up the images and you know what you're looking for. And his big thing was, it's all specific to urgent care. Those are the injuries that we're seeing. Other providers, seasoned, experienced providers, we've gotten great feedback that prior to, one of the things that we had a challenge with was, everybody does medicine a little differently, and that's okay, that's great. But in many instances, the injury, if you had a structured treatment plan or protocol like what OccDoc provides for us, that consistent training is very important, not only to the patient, but the employer. They know what to expect. They know that Mercy is not going to have a patient come back 10 or 12 times before referral to get an MRI or physical therapy or something like that. It's a structured plan, and the experience and the knowledge is from someone who's been through it, and they know. So our providers have given great feedback. It's easy to use. That's one thing we always hear, because providers, they want to treat patients. Yes, they have technology, and but computer's not the big thing. So let me get in there. Let me find what I need, look it over. The videos are short, to the point. The other thing that's been really wonderful that they like is, if they are, we've had a lot of new staff, if they need to train an MA on putting on a walker boot, wrist splint, they can just pull up the video, just watch this, then, we can do this together. But they've used it as a tool.
Great. Okay. That's good. On the side of the reporting function, being able to see which providers are using OccDocOne as a tool and what they're actually looking at and watching. What's your experience with that?
So this is great because as we have a new CEO and we're getting very serious about our KPIs and our reporting. And one of the things that we found is that the reporting, if you go and look, at who's utilizing OccDocOne, and you compare that with the patients that they're seeing, the actual, those who use it have been, just blowing through and following the protocols, and just, you can tell a difference. And what we've actually been able to do is go back and say, if we have a provider that's been hesitant to actually get in there and look around and do some research, we've been able to say, hey, this is a tool, this is here, we see that you've not been in it, next time you have this injury or that injury, go ahead and get in there and look at that, and the outcome could be better for you. So in our world, it's really helpful to help us get everybody on the same page and hold accountable. Yeah.
Great. So along those lines, have you noticed a uptick in the ability of your providers to do procedures like fractures, eye injuries, fingertip injuries, those areas that are most commonly being referred out that don't necessarily need to be referred out?
So what we talked about, we saw just what other urgent cares are seeing as well. It is the loss of, or the quickness to refer to the orthopedics or the specialty groups when we have a fracture or something we can keep in-house. What we've seen, and partly is because our providers were, frankly, they were, they're professionals at COVID testing now. They can repeat that speech in their sleep. But as the business and industry started to open back up and we started to get those patients in, we did see an uptick in, injuries and so forth coming in. But I think that OccDoc has helped us, and continues to help us in the treatment and the actual structure and getting them back to work in a more timely manner. The employers right now, everybody's had a little bit different of a year, 18 months, 2 years now. And to keep employees healthy and getting back to work in a timely manner is even more important to them than in years past. So we've encouraged our providers, and then there can be some hesitancy just about, I'm not sure. Let's just try it, and our medical director is just fantastic about, if you've got questions or, you need some to consult with me in regards to this, then get with me. But we as an industry, see, and in our specific area, we've seen that where we put an urgent care, not far away, an orthopedic urgent care has opened. So we've seen that as patients that used to come to us now just go straight to the orthopedic urgent care. The insurance companies, for your value proposition, they want to see that you're able to keep those patients and get them well in your facility. If you're coming into an urgent care and then you're referring to the ED or to an orthopedic that is much more costly, your value proposition goes down. That's important to keep in mind whenever you go to renegotiate. We've had changes this past year with the ICD-10 and the coding levels. And so it's even more important now as reimbursements for urgent care as a whole have gone down, to make sure that something we can keep in-house and follow a simple fracture, that we're doing that.
Yeah, that's great. So that's something I've been encouraging everybody out there to do, is to keep good track of your procedure codes so you can use them in renegotiating time with the payer, so you can show you do actually practice real urgent care. So that's great. Well, I appreciate your feedback so much, Barb. I appreciate it as the Director of Operations for Mercy Urgent Care, a big organization in North Carolina. And you folks are doing a great job down there. And appreciate your support with OccDocOne and appreciate getting your feedback today. So,
Dr. Taylor, can I add one more thing?
yeah, absolutely.
So one thing that we were really surprised about, and we had not anticipated, typically when you purchase any kind of software or really anything from a vendor, you know, that I call it that honeymoon period and the initial where, you know, that they're meeting you at every phone call, they're answering the phone, and every email you're getting a response. And then after the purchase of the product, that kind of goes away, and you could be then you're put over to the call center, or you don't have a specific person. We were extremely pleased that it's not like that with OccDocOne. We can get to Dr. Koehler, and also, you know, he's such a wealth of knowledge to be able to answer our questions, but always willing to help us grow too. So that has been a huge surprise and very impactful on our end. So thank you for that.
Thanks for those kind words. So I guess we'll close it off on a positive note on that. And again, I very much appreciate your time today, Barb. And I'm sure we'll talk soon. Okay.
All right. Thank you.
Take care. We'll see you. Bye-bye.
Bye.